Greetings again, Dr. Bill Wyatt with the American Orthodontic Society, and I want to do a little part two. This is really part two of a wrong where someone was treating a Class 2 Division 2 case that had a bad TMJ problem, and they had suffered for years with it. I did not see this case, but a young man that was in my lecture said he was there. He saw this case from the start, and he could not believe the treatment that this person gave them. Now, this was an international speaker that's telling you how to deal with TMJ problems and is teaching people to do that, and this is so wrong, not knowing any orthodontics. So let's get on with this case. Do we have her on the deal here? Let's see. I need to get started with it. What we gotta do? Let's start off without anything. Okay. Here is this young lady. She has a Class 2 Division 2 problem, and she had TMJ problem with it. Now these teeth were sticking down like this, and he said this woman came from Ohio, I believe, and it was down to Alabama there somewhere where it had come down, and she hadn't had any peace with her jaw joint, and then it hurt for years, and she came in, and the guy said, well, he could handle this case. And so he took the lady, he explained what he was going to do. He deadened these teeth up here, and he ground these teeth off like that at an angle. He did a root canal on them and sent the lady back to her hotel room, and she came in the next morning hugging the guy's neck and said the first time she had had a good night's sleep in I don't know how many years. And he had taken these teeth and cut them off right here and did root canals on them. And now she could bring her jaw forward. So she knew that if she got, well, the guy did, if I can bring her jaw out here, I'll get the condyles forward off the retrodiscal tissue, and it'll stop hurting. So how did you do it? Just ground the teeth out of the way. The other guy opened the bite and crowned all these bottom teeth. But this is a wrong treatment too. So we took this young lady that came in, and I told her, I said, if I put you in a split, I'm going to have to bring your bottom teeth out over your upper teeth. But if you give me a little time, I will, if the hurting isn't so bad, if you give me a couple of 2.5 months or something, I can move these teeth out and get them out of the way. And so that's what she elected to do. And that's exactly what we actually did. So you can see the lower teeth were coming up here and hitting these teeth, and that was holding the jaw back, pressing the condyles now back here against the retrodiscal tissue, creating a TMJ problem, but hers wasn't so terribly severe as the other lady. But the guy just ground these teeth off, and now he can move the jaw forward, and that solved her TMJ problem. And she had these roots up here with root canals and had them crowned. But you can imagine the root going one way and the crown going another way down here. That is the wrong way to do orthodontics. Now here's this lady. In other words, her jaw needed to be out here. See, so she couldn't move it because of these teeth right here. Now, one treatment just ground them off. And this is somebody speaking internationally and going around and teaching people how to do this simply because they had not been trained and shown that orthodontics is really the answer to the problem here, rather than you grinding the teeth off like this. So let's get on down with this. You look from the other side, the same thing. These teeth, now the roots of them will go up here. You ground them off so they put crowns on them that fit off of the roots like that. And let the jaw come forward. Now we took this case, and this is 1987, I think, in there. And this is her, sorry for her name on there, but anyway, we took these teeth and we rigged them up with an arch wire to pick these teeth up. And it gave me a couple of months to do that. And that's the rigging. We had an intruding wire with this other little way, reaching down and catching these teeth. And this was 12/28/1987. Now, we'll look at it like that in the bottom teeth. And this is the way it was, 12/28/87. And we had force on these teeth to pick them up and move it. And this is 2 days before, well, maybe 3 or 4 days before the January. And we went, and this is the rigging, it's on there. Now here, 3/15/88, in other words, January, February, and in the 15 days into March, January, February, March, about 2.5 months, those teeth that were back like that were out here. And the lady's TMJ problem was gone with it too, but we put her in a splint and bring it the rest of the way out. But there it is where it moved, sorry that picture, and we were pushing from here, back here, and picking this up and move this boulder back, but we went ahead and we're about to finish it. In other words, the teeth were here, and now they're here, and they're out of the way, and the jaw can come forward, and her TMJ problem went partially away. We put her in a splint and brought her mouth out that far. Now, if I had put those teeth out to this point, and I'd had a space back here, this point. In other words, he had to put crowns that much to fill the space. You close that up. Here they ground the teeth off, and now this is, I did not see this, I wasn't there, but there was a young doctor that was taking the course from these people, said, I saw it with my own eyes. This lady came in, and he deadened those teeth and ground them off, and she came back and hugged his neck. And so this is not right. This is wrong. And this is what I hope that YouTube and the Facebook and all the internet stuff, that we can talk to people all over the world. And I don't have any idea who you are or where you are. I would like for you to drop us a note or something back, and if you see anybody that we treated years ago, I sure would like to hear from them. So I want to say thank you for being able to reach people that far out. Now these teeth moved that far in 2.5 months and got out of the way, and the jaw could follow, and we leveled the bite and brought it out, except this young lady got married and she moved to Florida, and I referred her just before I completely finished it to a young man that had the courses that we had taught, and he knew what he was doing, and he took the case over from there. And so it brought him out to there in 2.5 months. You see, instead of grinding them off, you just move the teeth. And why we don't teach our dental students things that can be done orthodontically that make a whale of a difference in how you diagnose and present your case to people. And this is what bothers me. These schools have the orthodontic departments. They have the pediatric departments. There's pediatric orthodontics that ought to be done by the pediatric. There's things in orthodontics that all students should know if they want to do it and they're capable, okay, let them do it. At least show them what can be done, and this keeps this sort of stuff from happening. We put her in a splint and sent her to Florida, and to my knowledge, it's the way the case ended up. And so I appreciate you watching this and and so we're going to close out here, and thank you for watching, and I'm going to sign out here.